Ozempic, which is also known by its generic yung semaglutide, it's actually a drug and it is meant for those who have type 2 diabetes mellitus to control their blood sugars. And this medicine has two main functions. First is in increasing yung insulin levels that come from your pancreas. Another is the glucagon levels, both of which, when you activate, you improve blood sugar control. The thing about semaglutide is that they notice that when you're on this medicine, it causes weight loss. And weight loss per se, whether it is due to medicine or because you dieted and exercise, is beneficial. So, mas natuwa ang mga doctors natin because of the effect that they saw. Weight loss kasi is good eh. We want to lose weight because we also know that it causes a lot of medical problems. But taking any drug, not just semaglutide, any drug, you would need to be aware of interactions with the other medicines that you would probably need to take. There are some side effects. Like in particular for Ozempic, some patients would develop pancreatitis, especially if you had a previous episode. Okay? So whenever you take any drug, not just this drug, it would be better to consult a professional so that you are guided and you are monitored and you get the best outcomes. Because if you know about the mechanism of this medicine, it increases your insulin levels. And when you increase your insulin, your blood sugar drops. And when your blood sugar drops, so we call that hypoglycemia, you lose consciousness. You can go into a coma and you end up in the emergency room. Another, which is not as serious, is that we also know that part of the effect of semaglutide is it slows down the movement of your digestive system. So it makes you prone to have gastric issues. Kunyari, you're already experiencing reflux even before the medicine. With Ozempic, it will magnify. You would experience more reflux symptoms. If you're already constipated, for example, it will also worsen the constipation. So these are the things that you should know when you take semaglutide. If you go to us, diba, there are two important things, and it's lumped under lifestyle. The first is eating less, and you can call that a diet. Okay? And the second is adequate exercise. When you say eating less, you notice we don't say bawal ito, bawal yan. Okay? If you can eat 70% of your usual food, that's already considered a diet. Okay? You don't eat unlimited until you're full. You eat until you're 70%. That's fine. So with the second part, when we talk about exercise, the definition is 150 minutes per week of a moderately intense activity. It can be any activity. So like, for example, brisk walking for at least 30 minutes per day, 5 days a week, minimum. That's already adequate exercise. So when you combine diet and exercise, that will lead to weight loss. Weight loss kasi sa amin, medyo objective kami. So when you talk to a doctor, especially when you need to lose weight, first, we target 5 to 10% of your current body weight. Okay, 5 to 10% lang. So if you're 100 kilos now, we just ask 5 kilos, 5 to 10 kilos over 3 to 6 months. Yun yung objective measure natin, diet and exercise. That's an important concept that we need to debunk because the idea is if you take this medicine, mabilis, rapid ang weight loss. But that's not actually what happens. Because weight loss is individual also for each patient. And it also depends on a lot of factors. Because, for example, if you have polycystic ovaries, diba? Medyo matagal ang weight loss. It's a reality. But there are people who konting hindi lang kumain for a few days, mabilis ng weight loss nila. So the message is, weight loss is individual. It's not particularly more rapid when you add this medicine, although it helps when it is done properly. So I know we all want to lose weight. Okay, I am one of those who want to lose weight. But the most important way of losing weight is still through diet and exercise. If that doesn't work, Yes, your doctors can help you. And yes, so semaglutide is one tool to help us achieve that goal.